Hey, what's up YouTube? This is Dr. David Song at the Rehab Hero Clinic, and today we'll be talking about tennis elbow. Now, tennis elbow is also known as lateral epicondylitis and is a pathology of the common wrist extensors. So even though the pain is located at the outer elbow, it has more to do with the wrist function than it actually has to do with elbow function. And this is why doing elbow-based exercises like bicep curls and tricep extensions will not help to resolve the symptoms so much, because you are missing the target. The target muscle group will actually be the common wrist extensors. Some tests that your therapist might do to you to test for a positive tennis elbow are a Cosen's test or resisted wrist extension test, where they'll take your wrist, get you to extend it, and they'll resist. You got to resist them pushing downwards. Now, this extra stress will cause some pain as these muscles pull on that sensitive tendon. Some other tests include a middle finger extension test, as well as, once again, the muscles that connect to that elbow are being stressed. Likewise, stretching out the muscle tends to be painful as well, as we're actually increasing tensile load of that tendon group. So if you have tennis elbow, here are 3 exercises that you can do to start your rehabilitative process. Now, the first thing you can do to help alleviate symptoms is a soft tissue mobilization of the common wrist extensors. Now, you got to be pretty careful with this one, because if you go too hard, you can actually flare up your symptoms. What you're going to do is you're going to grab that ball, you're going to place your forearm palm down on your thigh or other surface like a bench or a table. From here, you're going to place that ball on the outer elbow, and you're just going to roll around until you find a sensitive spot. Once you find one, you can just slowly extend and flex your wrist. So when you're doing these self-massage techniques, you don't want to really exceed a 5 to 6 out of 10 on the pain scale. And this is because we're not trying to beat the muscle up. We're just trying to give it a different type of stimulus to help promote the muscles, this muscle group to relax. And once you do about 3 to 5 nice and slow wrist extension and flexions, you're just going to roll down along the muscle groups and find another sensitive spot and repeat. And you'll do this for 3 to 5 spots on this forearm. Really depends on how sensitive you are, and working mostly in the muscle belly. So you don't really need to do this where all of the muscles become more tendinous near the distal forearm, okay? Now, once the muscle group is nice and loose, we want to start doing strengthening exercises. The type of strengthening exercises that tend to help tennis elbow the most are eccentric based exercises. Eccentric exercises are negative phase exercises, which pretty much means that it's all about controlling how fast you lower the weight versus how fast or how much you raise the weight. So we'll actually be using our other hand to assist our wrist in this type of exercise. What you're going to do is you're just going to grab a kettlebell or dumbbell or even a band that's looped between your hand and your foot. And you're going to take your free hand and help that wrist go into wrist extension. From here, you're going to let go, and at a 5-second count, you're going to do a negative wrist flexion. So basically the wrist is going to flexion, but your wrist extensors are the muscles that are controlling it. So once again, we'll do another repetition. So generally speaking, I like to aim for between 5 to 7 repetitions, and in a relatively pain-free range of motion. What this means is that yes, you might feel some irritation of this common wrist extensor muscle group, and anything from a 1 or 2 out of 10 on the pain scale is within normal limits. But once you get 3 out of 10 or more, you may be aggravating your symptoms, and it just might mean you need to lower the weight or do a fewer amount of reps or work in a smaller range of motion. So here we are going for our 4th rep here. Now, when you're doing these exercises, you don't necessarily need to fear the pain that you might be experiencing. It doesn't necessarily mean that you're damaging the structures further, you're just making them more sensitive. So you want to take a look at how you feel after the exercise and the next day. And if you're feeling pretty good, it means you didn't push it too hard. But if your symptoms feel flared up, then that just means you have to scale it back a little bit. Doesn't mean that you damage the tissues further, okay? So really you want to pay attention to how much effort you're putting in and how much pain you experience while doing these exercises. The next exercise we're going to do, you're going to use a hammer or a dumbbell, and you're going to do what are called wrist supinations. with a small dumbbell, this is a 5-pound weight right here, you're just going to grab one end of it, okay? If you have a smaller hand, you could use a smaller dumbbell, like a 3-pound weight, or you can use, like I said, a hammer. The reason why we want to use something like a hammer is due to the uneven weight distribution and resisting the amount of rotation that's going to provide for your hand or wrist. So just like the last exercise, you're just going to use your free hand. You're going to bring that weight so it's in a bottoms up position, or your working arm is in a palms up position. And from here, you're going to count to 5 once again as you lower that weight down. You should feel your supinator working pretty hard as a supportive muscle to the common wrist extensor muscle group. 2, 3, 4, 5. Once again, just like the previous exercise, we really want to stick to a 1 or 2 out of 10 or less. You know, if you want to stick to a 0 out of 10 pain scale, that's also perfectly fine. And you can progress in terms of weight or repetition as you get stronger and better during the recovery process. Now, all the exercises that I mentioned today are exercises that you would typically do 2 to 3 times a week. Now, doing it every day will not give these muscles enough time to recover. You do want to give your muscles a 48-hour recovery period because that's just how long it takes for your muscles to start adapting to the load that you're giving it. Now, likewise, other than using a dumbbell, you can also use a kettlebell and go from a bottom-up position and resist the weight from accelerating during that downward phase. So you are using your supinators as your wrist goes into wrist pronation, just like that. So I hope you found these exercises helpful. These are 3 beginner exercises that you can do if you suffer from tennis elbow. Of course, you want to always go over new exercises with your healthcare provider. That can be your medical doctor, your chiropractor, your physiotherapist, whoever it is that you see to take care of your body. Make sure you get their go-ahead to make sure that these exercises are appropriate for you. Everyone's a little different. You want to make sure you are taken care of. Thanks for watching my video today on tennis elbow. Please subscribe to my channel, leave a comment below, and take a look at my Instagram page at Rehab Hero for more short video based content. I'll see you guys next time. Later.